So if there were such a thing as Oscars for development reports every year, I think this one would be a strong contender, Lawrence, and a lot of that is due to your passion, commitment and expertise. Lawrence Haddad.
Is this where I make a speech to say something about my mother and family? And no. So here it is. Thank you, Corinna and Imorn. They've been fantastic co-chairs. Thank you, panel. That was really inspiring. Thank you, Leith. You're only halfway through. Don't get too comfortable. Here's the report. It's 3 co-chairs, 20 experts in the expert group. Several of them are here today. Fantastic set of stakeholders behind it. 11 different donors, 70 different authors, hundreds of different reviewers. I want to thank everybody for the input into this report, and it's more than a report, it's an intervention. So let me just walk you through some of the key things, if I can do this. So the outline. It's going to be about 25 minutes, so if you nod off halfway through, resist the temptation, okay? We're going to talk about the SDGs, progress on nutrition status, progress on actions and interventions. We're going to talk about financing, and then climate, food systems and business, because we need to expand the circle of commitment to nutrition. Then we'll talk about accountability, which, as David said, is really the core connector between commitments and outcomes. Without that, we've got nothing. And then we talk about our calls to action. So, nutrition driving the SDGs. So a lot of people I talk to will say, why on earth should I invest in nutrition? And we can use lots of different arguments, and we do use lots of different arguments. There's the very fundamental human rights argument, especially the rights of children who can't claim their rights very easily. There's of course, the health reasons. We know that 45% of all child deaths under the age of 3, in one way or another, are linked to malnutrition. There's the intergenerational equity aspect. What are we doing as a generation now that's giving future generations the chance to thrive and blossom? And then finally, the economic arguments. And there are other arguments we could make. Gracia Michel talked about the education arguments, and there are several of them. In the report, we focus on the economic arguments mostly because we want ministers of finance to increase the funding for nutrition. So we go through the literature. Last year, we gave you an estimate, 16:1 is the benefit-cost ratio of scaling up nutrition interventions. We were very relieved to find a new set of analyses from a wide range of people that basically confirm this conclusion. If you convert that 16:1 into the compound rate of return over a 30-year period, you get a 10% return. If anyone offers you that investment opportunity, check them out first, make sure they're not a huckster, and then if they pass the due diligence, bite their hand off, take that investment. It is a fantastic investment, and nutrition is a fantastic investment. And I know you know that, but we need to go out and talk to ministers of planning, ministers of finance, people who run development agencies, people who run donor agencies, and just bang on about this because it's a fantastic, fantastic investment. Now, despite all of that, last year we said 17 goals, SDGs. Nutrition is mentioned in one of them, which is good. 169 targets. Nutrition is only mentioned in one of them, which is not very good. Loads of indicators. 2 of them are nutrition indicators. Well, that picture, unfortunately, hasn't changed that much. In fact, it hasn't changed at all. Here is a very simple word cloud. Take the draft SDG outcome document that's going to be ratified later this week or next week. Take that document, run it through your favorite word cloud program, and these are the words that come out. Hunger is there, poverty is there, climate is there, health, education, gender, women, you name it. Nutrition is not there. So despite all of this, nutrition barely registers in the SDGs. So the goals are set, the targets are set. The glimmer of hope is that the indicators are not quite set. And the report tells you exactly who to go to get the indicators into the SDGs. Because as David said, if it's not measured, it's not managed. So we need to get more nutrition indicators in there. Stunting and wasting are in there. The SCN did a very nice piece saying these are the key 8 indicators that need to be in the SDGs. A lot of other organizations got behind it. Every one of you in this room, you know someone who can influence that process. It's a political process. You all know somebody. Talk to them. Find out who it is that you need to influence and cajole and bully and nag to get more nutrition indicators into that set. Let's move on to progress on nutrition status. This is the slide. This is the number that I was most surprised, personally, I was most surprised about in the report. Last year, we noted that 24 countries for which we have data are on course to meet the WHO target by 2025. This year, we did the same exercise with the updated data set from UNICEF and WHO, who were fantastic partners, by the way, in all of this. 39 countries are now on course, up from 24. Now, that doesn't mean that all these countries had a fantastic year. It means that a whole slew of new data came in to the process because we're in the final year of the MDGs. But it just emphasizes the point that Michael Anderson so eloquently made in The Guardian a couple of days ago. If you don't have the data, you don't know where you are, you don't know where you need to go, you don't know what you need to do. You're flying blind. And there's only one outcome of flying blind, and it's not a good one. So it just shows you the value of data. So I was really encouraged. 39 countries on course. I don't want to get too carried away because 75 countries are not on course. The good part is that 60 countries are at least making some progress. They may not be making fast enough progress, but they're making some progress. Let's move on to wasting. I like the way I'm using this as a TV remote, pointing it at that thing. Wasting, 67 countries are on course, up from 59 from last year. It's not a terribly demanding goal, this one. The goal is to be below 5%. That's it. But still, it's great. 67 countries are on track for that. Under 5 overweight, 39 countries are on course. That's good. That's up from 31. Not much movement other than that. Here's a new indicator that we didn't report on last year, exclusive breastfeeding rates. The bad news, well, there's a couple of bad news points. The bad news is we only had data for 78 countries to be able to even make the assessment. Of the 78, 32 are on course. So that's not great either. What is that? 46 are off course, and 6 countries, the countries in black, are showing large reversals in exclusive breastfeeding rates, minus 10 percentage points declines over the last 2 data points. And the 6 are listed down there. I don't normally like naming and shaming, but I thought it was important to put those countries down. So on the undernutrition side of things, there are some positive results and trends, some not so good ones. But on the overweight and obesity, on the diabetes, and on the obesity-only side of things, it's pretty bleak. No countries have reduced adult obesity. This is using WHO data, looking at its model data, looking at the trends between 2010 and 2014. That is really, really worrying for a number of reasons, which I hope we can get to in the Q&A. This is a very crowded slide. I don't expect you to be able to spend a lot of time looking at it right now, but it's basically a global dashboard for the 8 indicators that we track very closely. The first 5 rows are the 5 WHA undernutrition indicators that we track. The last 3 are overweight, obesity, and diabetes. What we want to see is a lot of green and not a lot of red. Unfortunately, we've got a lot of red and not a lot of green. So this should be on everyone's wall. This should motivate you to do the kind of work you're all doing so brilliantly, how to get the red to become green. So we also monitor progress on actions, not just outcomes. We start off with the Nutrition for Growth commitments. We say the Nutrition for Growth commitments, how smart are they in terms of specific, measurable, assignable, realistic, and time-bound? Those are the kind of commitments we want, not fuzzy commitments. How smart are they? How many of them have been reported on, and how many of them have been met? So we did an exercise where we went through all the 200 commitments that were made 2 years ago in London, and to our dismay, we found that only 30% of them are actually smart. That means 70% of them are incredibly vague and incredibly difficult to hold people accountable to. Now, that may be very convenient in a sort of very expedient in a political short-term sense, but it's not very helpful for long-term action. N for G signatories, you must do better next time. Too many N for G signatories failed to report on their commitments this time. We nagged them to death, actually. Maybe we nagged them too much. But as you can see in 2014, 10% of the commitments were not reported on. That number jumped up to 21% this time around. About the same percentage of commitments were met, 44% as opposed to 42%. But if you don't report on your commitments, how can we hold you accountable? How can we even respect you? You know, commitments are not for Christmas. They're not just made at summits. They're things that we will hold you accountable to. Going beyond N for G, going into sort of interventions in general, this is the Lancet 12 interventions, the so-called essential interventions that deal with undernutrition that we know are high impact and that work in many places. Many of us work to scale up nutrition. We have a whole movement called the Scaling Up Nutrition Movement. Many countries that are not Sun members do exactly the same thing. And yet, we're in the position where we actually can't measure how well we're doing on scaling up nutrition. I mean, that's extraordinary. We're spending all this time on scaling up nutrition, and we can't actually tell how well we're doing because we've only got comparable national data for 3 of the 12 essential nutrition interventions. We must do better at collecting indicators on coverage. But it's not just about undernutrition, it's also about food systems. A couple of people on the panel said food systems are central to malnutrition in all its forms. They're not the only thing, but they're very important. And policymakers perched on their signs. They've got lots of different directions in which they go. They've got lots of policy choices, and some of the policies are listed here. How well are they doing at implementing policies to make food systems better? Not very well. We found data from 67 countries from the Nourishing database, and we found out that of those 67 countries, most of them are high-income countries or high-middle-income countries. Very few low-income and low-middle-income countries are implementing the kinds of policies and interventions that will slow down this tsunami of obesity. Remember, I showed you obesity in adults is increasing in every country in the world. Finance. If we want to scale up interventions, we need money. It's not the only thing we need, but we need resources. No matter how well you spend the existing money, a lot of the analyses in the report say somehow we need to find more money. Every country, our conclusion, every country is going to need to increase its spending on nutrition policies and programs. And when I'm talking about the UK, I'm not talking about DFID, I'm talking about Public Health England, the group in England in the Ministry of Health that's responsible for the UK citizens' health. Every country is going to have to do this. And why do we say this? Well, the first thing we need to do is to figure out how much countries are currently allocating to nutrition. The last year's report, we could only report 3 countries to you. This year, thanks to the Sun movement and the leadership shown by the Sun movement secretariat, we have data on 30 countries in the report, and they're all Sun member countries, and here they are. They stepped up, and they did something very difficult. They looked through all of their budgets, the thousands of line items, and they said, these are the candidates that are nutrition related. Now let's do a deep dive and figure out which ones are actually nutrition related. As of when we had to stop writing for this report, 14 countries had completed the exercise. By the way, that's a picture I took in William Chilufia's office of the Zambian budget document that William and his colleagues had to go through because there was no PDF version of it. Of the 14 countries that completed the exercise, the average allocated to nutrition, and remember, they didn't just focus on health, they went beyond health, they went to food and education and social protection and water and sanitation. 1.3% of those 14 countries' budgets allocated to nutrition. We don't know if that allocation will actually materialize, but that was the allocation. Is that a lot or is that a little? Last year, we reported that about 45% of all government budgets go to things like agriculture, health, sanitation, social protection, education. 1.3% of that 45% seems pretty small to me. But we do have some kind of aspirational target, because in addition to that 1.3%, the countries that went through that exercise identified an upper bound, a bound that they think they could get nutrition to because the potential is there. So the bad news, I think, is that 1.3% is the outcome. The good news is I think there's the potential to grow that, and the countries identified that themselves. What about the donors? The donors have been doing actually a stellar job. Well done, donors. I mean that very sincerely. I know how hard it is to increase funding for something when you're in a highly competitive environment. They increased funding on nutrition-specific interventions from $500 million last year to $1 billion, nearly $1 billion this year. So that's a doubling in a one-year period. That's fantastic. We also had a much fuller accounting of nutrition-sensitive allocations this year, because a couple of very big donors went through the exercise and completed it. So about $4 billion to nutrition sensitive. When you add those two together, you get $5 billion. When you divide that by the total ODA budget of about $130 billion, you get about 4%. So 4 of those 100 quarters in that picture are allocated to nutrition. So that's good. However, those donors are really sharing the those donors are really shouldering a massive burden. We also found that 13 of the 29 OECD donors allocate less than $1 million a year to nutrition-specific interventions. That's pretty feeble. And there are some very generous donors included in that: Norway, Sweden, Denmark, big ODA allocations, tiny nutrition allocations. Why is that? How much money is going to be needed? Well, this is a devilishly difficult thing to figure out. Fortunately for us, IFPRI, working with the World Bank and CIF and 1,000 Days and some other organizations, have come up with an estimate that I'm sure you've seen before, which says for 37 high-burden countries, what would it take to meet the World Health Assembly targets for stunting by the year 2025? Based on their assumptions and their calculations, they conclude that domestic spending has to at least double. Governments have to at least double, at least. And this is just for stunting, just for 37 countries. And donor funding has to quadruple. This is for nutrition-specific interventions, has to at least quadruple. The donors would front load, the governments would back load. And that's just for stunting for the 37 countries. So we need to find the money from somewhere. It has to come from governments first and foremost. If it doesn't come from them, nothing else will hang together. Donors have to step up, but families also have to step up. We need innovative financing mechanisms. We need to look for funding wherever we can find it. This is why in the report we focus on 3 areas that we don't normally think too much about in nutrition, certainly 2 of them: climate and food systems. We focus on climate and food systems and business because we feel that we need to expand the circle of commitment in these 3 areas. Without it, nutrition funders, governments won't be able to do it on their own. Ministries of health, ministries of food, ministries of social protection, they can't do it on their own. They need help. What's the potential for bringing climate, food systems, and business in? On climate, we make the point that nutrition programs and interventions really need to do a much better job of climate-proofing what they do. Why? What's the evidence for that? Well, here's some evidence. This is from India. It's from 2005, 2006. It's the national survey that until very recently was the most recent survey nationally. What this shows is height for age Z-scores, so standardized height for ages, how they vary for Indian infants according to the month in which they were born. So kids born in May, June, and July are significantly shorter than kids born in January and December. This is because of seasonality of climate, temperature, rainfall, food production, you name it, disease. How big are these differences? Well, I've put that little bar there to show you. 0.2 is the typical impact we would expect a complementary feeding intervention to have on height for age. And that's represented on that figure. So if a kid is born in February compared to one born in April, that difference is going to completely swamp the impact of that complementary feeding program. So this is a big deal. And it's something I think many of us have forgotten. And I think it's a kind of a casualty of this humanitarian development divide, actually. We don't think enough about wasting and seasonality issues. And it's a lottery for kids, and we need to end that game. We need to end that lottery for kids. Nutrition programmers and policymakers, climate-proof your work. What's in it for climate, though? There's something in it for nutrition. What's in it for climate to engage more closely with nutrition? Here's some evidence from Tillman and Clark, a paper they published in Nature towards the end of last year, surveying lots of diet evidence. And they tried to link that with emissions. They looked at all the different foods that were consumed in the countries they were consumed, and they said, what are the carbon emissions of the production and consumption and processing and transformation and distribution of all these types of foods? And they showed that it actually really matters what the different diet choices that are made really affect climate CO2 emissions. Now, so here's an opportunity for climate activists who care about climate mitigation to work with nutrition activists and policymakers to find out, in your particular context, is there a win-win space where we can make recommendations for healthier diets that are also have a lower carbon dioxide emission? And we think they may be, but the first stage is to start looking. Food systems. Food systems is everything from farm to fork, and some people would say from farm to fork to flush. So we talk a lot about agriculture and nutrition, but most of the food that most people in the world buy has a huge amount of value added once it leaves the farm gate. And food systems are systems that I think, haven't been scrutinized as much as they should be for are they delivering the right kinds of diets for people. Consider there are 800 million people who are hungry, there are 2 billion people who are micronutrient malnourished, and there are 1.9 billion people who are overweight or obese. That doesn't sound to me like food systems are actually serving those people. If you put all that together, probably food systems are only serving 2 out of 3 people on the planet. So we found out from the Lancet last week that diet is the #1 risk factor for the global burden of disease, not the burden of disease in Africa or Asia or Latin America, but globally. But how do you know if your food system is nutrition friendly? There's no dashboard to say how nutrition friendly is your food system. So a great chapter, I should have said the climate chapter was lead authored by Madeline Thompson, who's in the audience. Thank you, Madeline. The food systems chapter was lead authored by Rachel Nugent of University of Washington. And the challenge we set to Rachel was, give us a dashboard of indicators to tell the government of Ethiopia or the government of Senegal or the government of Indonesia how nutrition friendly their food systems are. And Rachel and her team came up with 4 buckets: food, how affordable is food, how diverse is the consumption set, what are the health and nutrition status outcomes, and how environmentally sustainable are they? And they came up with the 4 buckets and 13 indicators. Is this the definitive dashboard? No, of course not. Is it a good starting point for discussing what our food systems should be delivering and how we measure them? Yes. Business. We agonized about whether to have a business chapter or not. In the end, we agonized because we didn't feel we had a lot of new data to add to the mix. But we thought, we decided yes in the end because we felt there was just this massive dialogue vacuum. When we talked to people, there seemed to be 3 groups of people. One group of people who said, look, we're not going to engage with the business sector because we just don't trust them. And there was another group of people that said, well, if you don't engage with them, engaging with them is the best way of generating trust. Actually, those are those 2 groups. So we said, well, let's take this on. Let's try and generate some kind of dialogue, at least, about all of this. So we were confronted with this chicken and egg situation very early on. Do you engage to generate trust, or do you trust and then engage? So in the report, we try to focus on the trust bit and on the engage bit. On the trust bit, we said, look, transparency and monitoring are ways to generate trust. So we highlighted a number of different mechanisms that we thought were worth a try. At the moment, there's no public register of public-private partnerships. Why not? If it involves public resources and public money, it should be a public register. The extractive industries have come up with a really interesting and seemingly effective initiative called EITI, Extractive Industries Transparency Initiative. Maybe we should try something like that in nutrition. The Gates Foundation and the Bloomberg Foundation have just set up an anti-tobacco litigation fund to help governments deal with challenges from companies about legislation that's already on the books. Maybe there should be something like that in nutrition. The ATNI, Access to Nutrition Index, I'm actually personally a big fan of this initiative. It's all self-reported data from these big 25 companies. So, you know, you've got to take that at face value, but at least they're asking the questions. At least the companies know they have to respond to those answers. And I'd like to see more of those kinds of initiatives, the report would. And then public research. People in the audience who fund research in nutrition, there's not one single program that's dedicated to looking at whether public-private partnerships add value to nutrition or not. We did a big research, we did a big review, we talked to Mark and his team at GAIN. It's pretty clear that fortification is a good thing, and it's pretty clear that private sector is important for fortification. But beyond fortification, the evidence base is pretty thin, pretty thin. Please, research funders, fund something in this area. And we think it's so important to build trust because there are so many opportunities. As Erthrin said, business is already delivering nutrition. They're already there. We can't just pretend they're not. We have to figure out how to incentivize them and sometimes regulate them into not doing bad things and doing more good things, more positive things for nutrition. And because the dialogue is so feeble, really, there's people who think business is the best thing ever and people who think it's the devil. And I think there's a big silent majority in the middle who are thinking, and I include myself in that, who think, actually, there must be some things that business will be really good for in some contexts, in some countries, for some indicators, for some groups, for some services and products. But I need some kind of guideline. I need some kind of compass to help me walk through that minefield of public-private business. And it may seem kind of a bit feeble to have a call to action that says we need a dialogue, but no one is talking about this. No one is talking about that middle space. How do we navigate through that middle space? So we think once the WHO framework for engagement with non-state actors, which is private sector and civil society, is complete. It was worked on at this year's World Health Assembly. Once it's finished, hopefully at next year's World Health Assembly, that the big four UN agencies, especially the normative agencies, should really be our guides and our beacons and set up a time-bound, inclusive, and by inclusive, you know what I mean by inclusive, not just public sector organizations, commission to develop a shared understanding of the roles and responsibilities of business. Finally, accountability and data. This is our bread and butter, accountability and data. It runs through every chapter, but we thought it was important to have a single chapter which is dedicated to it. We talk a lot about accountability at different levels. We talk, interestingly enough, responding to Joy and Grasha's points about community-led accountability, we talk a lot about the different mechanisms and tools available for a community-level accountability. But I just wanted to share one slide with you on data. Last year, we reported to you that 99 out of the 193 countries could actually report on their WHA indicators, the full set of 4 that we tracked last year. So that's gotten a bit better. Now we have 108 countries that can track the 4 WHA targets, but we don't want to get too carried away. There's still 58 countries that can only track 1 WHA targets. What's the point of having the targets if you can't measure them? Calls to action. I've pretty much been through these. Elevate nutrition in the SDGs. That indicator window has not yet closed. We think it will close by the end of November. Some people say by the end of December. But the indicators have to be finalized and published by, I think, March or April of next year. Strengthen national accountability on nutrition. Leaders from Ethiopia, Malawi, Senegal, Indonesia, I know you're in the audience, and many other national leaders are in the audience. Don't rely on the WHA global indicators to set your national targets. You need to set national targets that you own. Joy said it. Targets need to be owned, whether it's by communities or governments. Set national targets. The Rio pledging moment next year is not just a pledging moment for money, it's a pledging moment for targets. Set your targets on stunting and wasting and obesity and women's anemia. Now's the time to do that. We didn't find many targets, national targets, out there that went beyond more than 1 or 2 or 3 years. Strengthen the nutrition for growth commitments. World doesn't need fuzzy commitments. Make them specific, measurable, and time-bound. And report on them, please. Implement actions. We need better data on how much coverage we have of the undernutrition interventions. We need to close the implementation gap on the food environment. We need to find more funding for nutrition action. I know that's a really boring and predictable thing to say, but I'm pretty convinced, and others are pretty convinced in our team, that we need more funding for nutrition. We have to be clever and creative about how to get it, and we have plenty of ideas out there. Build alliances with climate, build alliances with food systems, build alliances with business. The powers that create malnutrition, they're very, very powerful. The forces that create it are very powerful. To overcome malnutrition, we need equally powerful alliances and forces. And health and food and donors and those parts of government, they can't do it on their own. They need other sectors to join, but we need to give other sectors an incentive to join. And then finally, identify data gaps that hinder action. Not every data gap needs to be filled. The ones that hinder action that we know will reduce malnutrition, those are the ones that need to be filled. So my final slide is rather a kind of a bit of a silly slide, because the report's quite severe and quite serious. This is a picture that I saw in an article in one of the newspapers recently that was about designer babies. In the future, it sounds like a pretty horrific future, but in the future, we'll be able to modify DNA to generate these kinds of attributes. And I was just looking at this and reading this, and I thought, well, high IQ, linear growth, muscle mass, 20/20 vision, strokes. I wish baldness, personally. I wish baldness would be a type, but not. These are things that nutrition does. We don't need designer babies for DNA alterations. We just need people to invest in nutrition. Thank you.